Set 25 protocol technical question and answers. Answers are highlighted in green. Question 1. Protocol amendments. A phase 3 oncology clinical trial is ongoing when new safety data emerges, requiring an update to the inclusion criteria. What is the most appropriate step before implementing this change? Option A says update the protocol and immediately implement the changes in ongoing patient enrollments. No, you cannot make the updates in the protocol without even informing the stakeholders. Option C, notify only the investigators and continue the trial as planned. Now, the investigators, they are not the only stakeholders in a specific clinical trial for conducting or making any decisions, right? So, this is not the right answer. Stop the trial and reinitiate it with a new protocol. Now, you already have a protocol which was already designed and it was approved, right? But due to some new safety data, there requires an update in the inclusion criteria. So it does not make sense to stop the trial and reinitiate it with a new protocol, right? So protocol is fine, but the data has emerged in a different way. So because of that, you require an update to the inclusion criteria. So stopping the trial, it's not make sense. So option D is not the right answer. So the correct answer is you need to submit the protocol amendment to the regulatory authorities and ethics committee for approval before implementation. So correct answer is B. Question 2. Ethical considerations in protocol development. A sponsor is designing a protocol for a rare disease study where placebo control is being considered. Which ethical guidelines should primarily influence the decision to use a placebo? The study should always include a placebo regardless of disease severity. Now, it is not mandatory and essential to use placebo in each and every clinical trial, right? So, this is not the right answer. Placebo is never allowed in clinical trials. Well, this is not absolutely true. Placebo is allowed to be used in clinical trials wherever possible and wherever required as per the study design. So this is not the right answer. The sponsor can decide independently without consulting ethical guidelines. No. So the sponsor has to discuss with the ethical authorities and the regulatory people before making any changes or implementing in the clinical trial study. So sponsor has to always consult the ethical guidelines. They cannot make decisions independently. So this is not the right answer. So the correct answer is if an effective standard of care exists, placebo should be used only when withholding treatment does not pose significant risk to participants. So the correct answer is B. Question 3. Sample size justification. A clinical trial protocol states that 300 patients will be recruited based on statistical power calculations. Midway through the study, the DMC suggests increasing the sample size. What should be the next step? Option A. Continue the trial without any changes to avoid delays. No, you cannot just make the decision to continue the trial, right? Immediately increase the sample size without any formal amendments. Now, whenever you want to make any changes in terms of sample size, you always have to make a proposal and then you need to make amendments and then you need to go for the approval. So you cannot make any changes without any formal amendment. So this is not the right answer. Stop the study and reanalyze the data with the available sample. No, you cannot even stop the trial. The reason is you just have to increase the sample size, right? So the correct answer is amend the protocol, justify the new sample size and seek regulatory and ethics committee approval before implementing the changes. So the correct answer is B. Question 4. Randomization procedure in the protocol. A clinical trial protocol specifies that patients will be randomized in a 2:1 ratio, treatment is to placebo. Which of the following scenarios best describes an issue that could arise with this approach? Option A, it ensures an equal proportion of patients in both groups. No. This ratio ensures all patients receive active treatment. No. The randomization ratios are not important in clinical trials. Well, randomization is always important in clinical trials. So this is the vice versa statement. So this is not the right answer. So the correct answer is the treatment group may have more dropouts then the placebo affecting the balance, right? So that is the reason we use this issue. So the correct answer is B. Question 5. Inclusion and exclusion criteria violations. During site monitoring, a CRA discovers that an investigator enrolled a patient who did not meet one of the inclusion criteria listed in the protocol. What is the best course of an action? Option A. Immediately withdraw the patient from the study and delete their data. No, this is not the right answer. Just because you noticed some kind of finding or an issue, you simply cannot withdraw the patient. Whatever the data that is available after entering into the clinical trial study or after giving the informed consent, all those data should be present and available, no matter even if the patient tried to withdraw during the recruitment phase. So all those data should be available. Option C, ignore the deviation and allow the patient to continue. No, you cannot even ignore, delete, or make some changes or do some manipulation with data wherever there is clinical trials data is involved. So option C is not the right answer. Option D, modify the protocol retroactively to include the patient. No, you cannot just simply make any modifications and just include that patient, right? So the correct answer is option B, report the deviation. You need to document the reason and determine if the patient can safely continue with protocol deviations noted. So the correct answer is B. Question 6. Endpoint selection in a protocol. A clinical trial evaluating a new diabetes drug defines its primary endpoint as a statistically significant reduction in H1B-A1C levels after 24 weeks. Which of the following should be included in the protocol to ensure meaningful results? Option B, a flexible time frame to allow variations in endpoint assessment. No. Inclusion of only primary endpoints without secondary ones. No, whenever you're doing any analysis, you need to ensure that you need to include primary and secondary, if possible the exploratory or surrogate kind of endpoints, right? So all those things should be mentioned. So this is not the right answer. Option D, avoiding statistical significance calculations in the study. Well, you cannot avoid, delete, or do any kind of manipulations in the clinical trials data set. So the option A is the right answer, which says clearly defined measurement methods for HbA1c. Question 7. Handling serious adverse events in the protocol. A protocol specifies that all serious adverse events must be reported to the sponsor within 24 hours. An investigator notices a patient experiencing an SAE but waits until the next monitoring visit to report to it. What should happen next? Option B, the sponsor should disregard the delay and continue the trial. No. Sponsor has to ask the question as to why it was not reported within 24 hours, especially when there was an SAE. Option C, the protocol should be revised to allow for flexible SAE reporting timelines. No, just because you know that SAE has occurred and just to save the clinical trial, you cannot make such decisions. So this is not the right answer. Option D, the site should be immediately closed. Now, you not necessary to close the trial just because the investigator is noticing a patient experiencing an SAE, right? So it's not necessary to close the slide completely. So this is not the correct direction. So the correct answer is the investigator should be restrained on the protocol's SAE reporting requirements. So the correct answer is A. Question 8. Protocol compliance and deviation management. A site investigator decides to adjust the dose of an investigational drug for a patient because of unexpected side effects, despite no protocol defined dose adjustments. What should be done? The investigator should make dose adjustments without reporting it. No, just because he has occurred any side effects, you cannot make changes in the dose. Whatever dose that has been designed or that has been decided to give to that specific patient, only those adjustments to that particular patient should be given. The option C says the protocol should be ignored since the investigator's clinical judgment is superior. No, you cannot ignore the protocol. Protocol is the foundation and the backbone for conducting the clinical trial to ensure that this clinical trial should be conducted in this specific way. So protocol is the foundation for conducting the clinical trial. Option D, the trial should be halted due to the deviation. No, it's not mandatory, like just because one side effect has occurred, you don't need to change the dose level of that specific patient, right? So the correct answer is the investigator should document the deviation and notify the sponsor immediately. Then the sponsor and the investigator, they need to sit together and they need to coordinate as to what should be done in specific this condition. So the correct answer is A. Question 9. Unblinding in a double-blind study. In a double-blind clinical trial, a patient experiences a severe allergic reaction. The investigator believes unblinding is necessary for appropriate treatment. What should be the correct approach? Unblind the entire study immediately? No. Just because one patient has occurred allergic reaction, you cannot unblind the entire study, right? So this is not the right answer. Option C, unblinding should never be done under any circumstances. Well, this is not kind of very closed kind of an option, right? Some part should be available because if the patient has died or if the patient has given any severe allergic reaction, then there should be some flexibility. It should not be that completely you should never do the unblinding. So this is not the right answer. Option D, continue treatment without unblinding as it may affect the study integrity. No, you cannot continue the treatment, whenever there is a severe allergic reaction. So the correct answer is A, unblind the treatment allocation only for the affected patient after following the protocol defined emergency unblinding procedure. So the correct answer is A. Question 10. Protocol specified interim analysis. A protocol includes an interim analysis at 50% patient enrollment. At the interim age, the results indicate a strong efficacy signal. What is the best next step? Option B, continue to full enrollment regardless of interim findings. No. Whether to continue or discontinue, that is based on the interim analysis, right? That is why it is conducted. So you cannot continue with whatever you have, even though you have the interim findings. Change the protocol to add new endpoints immediately. No, you cannot just make any changes just because you indicate a strong efficacy signal, right? So you don't need to change the entire protocol or change any endpoints, like immediately. Option D, ignore the interim analysis and proceed safe plan. You cannot proceed it further even though, like there was a strong signal in efficacy. So this is not the right answer. Option A says stop the trial early if the efficacy is overwhelming and meets predefined stopping criteria. So whatever the stopping criteria, if it is matching, whenever such kind of situations are seen and the data shows a strong efficacy signal, so in those scenarios the decision can be taken to stop the trial and see whether if it is meeting these specific stopping criteria. So the correct answer is A. Please like, share and subscribe. Leave a feedback comment mentioning any topic that you want me to make a video. Looking forward for a positive response. Thanks for watching. Please like, share and subscribe. Leave a feedback comment. Many thanks for your support and having great connection.